Systane Ultra quickly and permanently eliminates signs of irritation, such as discomfort, redness, itching, dryness, a feeling of sand in the eyes, burning. After installation of the drug, a thin polymer film forms on the surface of the eyes, which moisturizes and protects the cornea from drying out and infection. The drug does not irritate the eyes, it is evenly distributed over the surface of the cornea or contact lenses. It is gradually washed out when blinking along with the lacrimal fluid. Uses of Systane Ultra. Systane Ultra ophthalmic moisturizes, provides comfort and protects the eyes from dryness, irritation, burning sensation, foreign body sensation or gritty feeling caused by dust, smoke, UV rays, dry heat, radiation, sauna, eye conditioning, wind, cosmetics, flickering long-term TV or computer monitor. How to use. Use exactly as directed on the label or as prescribed by a doctor. Don't use in larger or small amounts or fall under than recommended. Don't use this medicine while wearing contact lenses. Systane may contain a preservative that can discolor soft contact lenses. Wait at least 15 minutes after using this medicine before putting in your contact lenses. Wash your hands before using the eye drops. Systane Ultra ophthalmic can be used as needed throughout the day to hydrate and improve eye comfort. Place 1 to 2 drops in each eye and blink. To apply the eye drops, tilt your head back slightly and pat down your lower eyelid to create a small pocket. Hold the drop above the eye with the tip down. Look up and away from the drop and squeeze out a drop. Close your eyes for 2 or 3 minutes with your head tip down, without blinking or squinting. Gently press a finger to the inside corner of the eye for about 1 minute to keep the liquid from draining into your tear duct. Use only the number of drops your doctor has prescribed. If you use more than 1 drop, wait about 5 minutes between drops. Wait at least 10 minutes before using any other eye drops your doctor has prescribed. Don't use the eye drops if the liquid has changed colors or has particles in it. Call a pharmacist for new medicine. Contraindications. Don't use the solution in patients with increased individual sensitivity to any of the components of the drug. Precautions. Talk to a doctor if you experience symptoms like eye pain, altered vision, or any other unusual symptoms after using these eye drops. You do not feel any improvement in redness or irritation in the eye. You do not feel any improvement and your condition worsens or lasts for more than 3 days. It is advised to discard open single-dose container after use. If you accidentally ingest or swallow this medicine, contact a doctor or visit the hospital immediately.